going south.
problem for Cleveland.
It's going south.
You think so?
Too much money to give away.
Yeah.
It's about money, man.
Yeah,
It's going south. 6 or 7, but Golden State's gonna win.
Yep.
Anybody think Cleveland?
Only people in Cleveland think Cleveland.
I can't say I'm a big Kevin Durant fan, but
He looked good.
he's really improved.
He looked good last night.
Improved both ways.
That's maturity. He looked real good yesterday.
Yeah.
You're right. Defensively, it's good. Yeah.
But don't be shocked. Game 2, Game 3, Cleveland just comes out of the wood. The mileage is the other way around.
Well, I'm from Cleveland, so I tend to.
Oh, so there goes somebody cheering for Cleveland. Okay, cool.
I'm going to be cheering for Cleveland.
I respect that.
Kept that kind of low.
Yeah, real low.
Right.
He's gonna wait till after Cleveland won a game, then he'll probably say.
Okay, so we got everybody that's going to be here today, so let's go ahead and get started. And I guess we'll thank everybody first for coming today. This was a special meeting that set up in very short notice. But it's a meeting we had to have so that we can get our insurance in place by the end of the season. So it's important, and before we get started, I'd like to make a comment on this presentation and the process in general. This is probably the biggest expense that you're going to ask us as a board to approve. So it has huge implications for us as the board and the company. But it also has huge implications for the Chatham boys. So this is an important step, and I would say that I personally feel a little rushed with this because we've got all the information this morning, and you're going to present it and then ask us to vote on it.
Today?
I would like to have seen this last month.
Correct.
Because I think that all of us had questions, all of us had comments, and I personally am not real comfortable doing this.
I thought this was a presentation today to vote for at our board meeting. And I
Timing of the
agree.
quotes that came in for the insurance, we missed the May board meeting, and in order to open a loan with the employees, we need a few weeks in June to do that, so we can be signed up by July 1st. So the timing of when the quotes came in, we were faced with a situation where we had to have a board meeting to adopt this before we could enroll our employees. And like I said, because we missed the May board meeting, the quotes weren't in yet, that created the discrepancy.
So
how do
just
we fix this
to put it on the
moving
record, so
forward?
moving forward, we just want to make sure next year we start this sooner. We stay.
The Blue Cross Blue Shield will not quote until 30 days from renewal. 60 days from renewal.
And we can work to, there are times when we can get that earlier.
We try to get it as early as possible, but it is 60 days before they release the renewal, for obvious reasons. There's 2 months of claims in there that, they will
Correct.
not be accounted for when they give you this firm renewal for July 1. So they're not gonna do it 4 months out or 5 months out,
I
because they don't have the
understand.
data, so.
But 60 days is 60 days, and
Yeah, we're-
1 day is 1 day. I mean, so this
Exactly, I
is,
understand.
And the other alternative would be to push the employee renewal and adjust premium deductions, because it requires 5 to 15 employee deductions be entered before the first payroll of the fiscal year. But there's ways to adjust all of those things.
we're all going to have lots of questions. I know that I've got several, so I'll come back to the questions later. I would just like to say this up front, and I for one, am not comfortable with this. Now, the fact that the total cost of the insurance is going down makes me a little less uncomfortable. But still, there's a lot of things I would like to know. How do we compare to the county and the city? How do we compare to other transit agencies? So I would like to have seen more of a presentation that showed me that what we're looking at is what everybody else in the neighborhood is looking at. And then when I looked at it, the high option, I really like the triple choice, and I think it's a great deal. But I see the high option, we've lowered our deductibles, and we've lowered our total out-of-pocket maximum. I think in this insurance market, when all the costs are going up, our deductibles we had in place were not bad. Did we need to reduce the deductible? could we have kept it where it is? It may reduce the premium. It's a question I would like to have asked. Not be looking at this sort of as a favor, please, because we have to do it.
Mr. Chair,
James.
on the reference, I know you said you wanted to comment and make it before the debate, and you made it. But then we're slipping back into discussing something before we approve it and
Same
open the
thing.
meeting up.
No, we're going to discuss it now. I just wanted to get this on the record, because we as a board, I don't think any of us are happy
Yeah,
having this
I'm
thrown on us
definitely
at
not
the last
happy
second.
with it. I'm not having to vote on it today, and I'm not. But either we gon' go vote on it, if we need to open the meeting up, let it be procedural while we voting on it, and all the questions need to be asked. I don't know how many of us have meetings or other prior commitment, but we should take as long as we can with this, since it's so much. When we just met, what, a couple of weeks ago, finance committee? Didn't we have a committee meeting?
We had a board meeting May 16th, and the committee was before that.
Yeah, we had the financial meeting a couple of weeks.
You
They
couldn't have this
don't have-
report ready then?
No, sir, the quotes come in after May 1st,
Mhm.
and Seacrest needs time to compile and compare the multiple quotes they get from multiple firms.
I understand that.
Right.
I
So
understand.
this was really the earliest all of that.
Could
what-
have been it.
Yeah, every year we have a special call meeting at this time in order to facilitate the Blue Cross or the health insurance
Right.
renewal in time to get our employees set up with the new
But it
coverage.
isn't just them getting the quotes, then they put it all together, and then we need to meet with them, because we need to go through this with them in detail and
Mhm.
vet out issues or whatever, and ask them to change things or go back and get a better deal. So that process takes place, then it goes to the board.
Okay, so James, I think if you're done, I think we move ahead with the meeting, Curtis, and get the presentation, and then we can start asking questions.
Yes, sir.
If we don't feel comfortable in voting on this today, is there a chance that we would have another fall meeting? I mean, if everything's not resolved today?
Let's see where we
Okay.
are. The other thing, though, before we start, is we do need to do roll call.
Yeah.
And we have the two bills, both excused. The bill broker has been on vacation. He's on vacation for 2 weeks in Endurance is at the city.
Yes, city strategy.
So we need a motion to excuse them.
So
So-
moved.
A second? All those in favor say aye.
Aye.
Aye. Motion carries. Beverly?
Thank you. Good afternoon. Chairman French,
Present.
Ms. Stone,
Present.
Mr. Dawson,
Here.
Mr. Latakis,
Yeah.
Mr. Holmes,
Yeah.
Mr. Megadoff,
Here.
Mr. Jones.
Present.
Thank you.
So,
All right, so we'll do a presentation first with Seacrest, the floor is yours, and we'll get the process started.
Stand here on the corner.
Sure.
However you wanna do it.
Well, first of all, thank you so much for being here and having this call meeting for us, to go over the employee benefits program today. I want to introduce to you, Seacrest partners, Krista Wagner. Most of you have seen her in meetings before. And we have a new associate with us today, Brad Jones. He is new with Seacrest and joining us in our employee benefits department. And I'm Terry Doyle. So, yeah. The annual renewal process, I understand the feelings of being rushed today with what we put together, but we've actually been doing this since the 1st of May, but unfortunately we could not get everything together by your board meeting, which I think was the middle of May. Because quite frankly, we get the renewal in 60 days prior, so we don't get it until May 1st or 2nd. And then we start working with that renewal plus getting out all the quotes that we need to get in. And most of our carriers they're going to want to know, are they getting a big rate increase or not? Because that's going to affect if we even want to quote the group or not. Because if you're going in with a big, huge rate increase, they know there's something there that maybe they don't want to quote. So the process that we have at Seacrest is we monitor all the insurance policies and procedures all year long. and we meet on a quarterly basis. We put together a financial quarterly report, which is available to you if you'd like to see it. But we do that every quarter, and we meet with CAT's Health and Wellness Committee, going over the quarterly review, and we talk about claims issues, design issues, RX, a gamut of what's going on with the plan, what do we need to address, and how do we need to address it. Then when we get to the marketing process, we market with all the carriers, and then we request proposals from all of them, which, as you can imagine, there's a lot of give and take, back and forth, questions asked, data reviewed, sent additional data to them. So it takes a while for them to get their proposals to us. Once they get to us, then we review and analyze all the proposals we get, and we try to come up with plan designs that we think are most valuable to the employees and price-wise to CAT. And then we put those proposals and recommendations together, and then we meet again several times with CAT to go over or massage those proposals and tell them what we've come up with. And it's not just the medical plan. It's the dental, it's the vision, it's the life, it's the disability, the short-term disability. So it's the whole employee benefit package that we're looking at. As most of you know, CAT's been insured with Blue Cross Blue Shield for 25 plus years. They've been a good carrier for CAT in that we've been able to negotiate and get some concessions from them. We have never actually gone in and accepted their first renewal offer. We've always negotiated that down. Last year, we got it down to a 0, so we had a flat last year for 2016. It started out, their first renewal that comes to us in May was a 7%. This year, there was a 22% increase, which we negotiated down to 10. And a lot of that 22% increase was the loss ratio for the group was continuing to climb until it was in the 80% bracket. There was also a concern with a large claim that was hanging out there. So, of course, we weren't going to accept 22% anyway, but we did get them down to 10. And then we compiled the data and submitted RFPs to all the fully insured carriers. That's Cigna, Aetna, Humana, and United Healthcare. In this market today, we don't have as many carriers as we've had in the past. These are the carriers, fully insured carriers. Cigna declined to quote. They looked at the plan, they looked at the rates and said, we're not going to be competitive. We declined to quote. Humana quoted a POS plan that's similar to what you have right now, and it was a 14% increase over what you have now. And they also quoted an HMO plan that was more in line, but it was 1.6% increase. Aetna quoted a POS plan that was a 6% increase. And United Healthcare quoted, to get us in the price range that we wanted, was a dual option HMO plan. And when we say dual option for them, it means you had to offer these two particular plans. You could not offer one over the other. So, and it was about a 1.8% increase. Aetna and United Healthcare plans included several decreased benefits with respect to coverage and network availability. And when you look at these spreadsheets, that is where you're going to see the detailed information on what were the differences in the plan designs that were offered. And our benefit comparison, like I said, is a lot more detailed in these spreadsheets that you have. But basically, the POS plan for Humana increased the out-of-pocket maximum for the employees. The HMO plan for Humana has a limited network. Humana, in the network arena, really has a hard time competing with United Healthcare and with Blue Cross Blue Shield, who have the largest networks. So it is a limited network, so some of the employees may needed to change physicians. Aetna, their quote increased the maximum out-of-pocket, and it also increased the copays. United Healthcare had the dual option HMO that was required. It did increase the out-of-pocket maximum, and they also have a tiered network, which is a tiered network for in this plan was if you go to a primary care physician and you go to one of their preferred physicians, you have a lower copay. So there was a lot of education process that would be involved so that the employees could go on the internet and find out if their employees preferred or not. and they would get the better deal or the better copay if they go to the preferred network. So it's a little different than most plans. But the biggest caveat to me was it also included, in addition to the $2,000 deductible, is a $500 copay for any outpatient procedures. So in addition to the deductible, you would have an additional $500 for outpatient procedures and an additional $1,000 if you were inpatient. So there was an inpatient copay as well. So big differences there, and not something that we thought we could recommend. So we're back with Blue Cross Blue Shield, and we're negotiating with them on how do we get this plan even. We are not going to pay more than what we paid last year, if at all possible. We had a lot of discussion with the group about offering plan changes or plan design choices for the group, because as you well know, not every plan suits every person. So we came up with 3 different plans for CAT so that you could offer a choice to your employees that best fits their personal budget and their benefit needs. Offering 3 plans gave us varying levels of premium. It reduced CAT's portion of the total premium. As you know, CAT pays 70%, the employees pay 30%. It's a 70-30 split. And on the CAT contribution to the total premium, it actually dropped from $1.5 million to $1.3. And these are based on our assumptions of enrollment, because keep in mind, we've got 1 plan now we're offering 3. So we had to give some assumptions about how many people we thought would enroll in the high, the mid, and the low plan. The low plan, which is the most cost-effective plan, is a HSA health savings account compatible plan. And we've talked about health savings accounts before, maybe offering that. So to have a health savings account, you have to have a qualified high deductible health plan. That's what this plan is. It has higher deductible and out-of-pocket maximums, but it offers affordability. And in all plans, the preventive care is paid at 100%, no deductible, no coinsurance. So the middle plan is the mid-level deductible with higher out-of-pocket maximum with a specific RX deductible that's not applicable to generics. And what this did for the plan was brought us down to a manageable premium, and there is a deductible on RX, which is addition to your plan deductible, but on the RX, there are tiers for generic and level 1, level 2, level 3 drugs. There's a $200 deductible annually per person on the drug. So once you pay that $200 for the first drug, and it has to be the higher tier drug, it doesn't count towards generics, then you're done and you just pay the copays. We thought this was attractive for CAT because if you look at the data for CAT, you've got over 85% of your people that are using tier 1 or generic drugs. So that deductible copay doesn't affect as many people because it does not apply to any of the generics, which your people are utilizing, which is a very good thing. The high plan that they can buy up to matches the current plan in all coverages, but it reduced the current family deductible, and the preventive again is at 100%. And what we did with this high plan, when you look at it, you're going to say, it looks like the plan we used to have, and it really does, except the out-of-pocket maximums were higher, and we went back to Blue Cross and renegotiated that and said, can you give us a lower family out-of-pocket, which they agreed to do after some consideration. So this plan is the high plan that closely mirrors your current plan, but actually reduces the premium. Sure.
And I hope this is not an unfair comparison, but with the county, we have Blue Cross and Blue Shield. And I am so tired of having to argue with Blue Cross and Blue Shield over prescriptions that, for instance, bone density, my doctor wants me to take some calcium building bone. Blue Cross and Blue Shield has held me up for 6 weeks rejecting what my doctor has asked me to do. So I don't want that to happen to the employees here.
Yeah.
And I want to be real clear about that. I think that's inexcusable. If you're trying to do preventative maintenance and your doctor requires something and your insurance company that you've been loyal to says, sorry, we don't like that drug, you're gonna have to come up with something else, and the doctor's got to do the research, and it's just not
I know,
right.
we've all been in that. Well, the drug plan under all of these Blue Cross plans is the exact plan that is in place right now. The only difference was just adding a deductible to lower the premium.
Okay.
So I don't know if you've had any issues with employees or.
None that have been worked out intentionally.
Okay, good.
So I think we're okay.
Okay, I just don't want anybody here to go through that, because I find that inexcusable when you're trying to do the right thing. See your physician, do what you're supposed to do, and then they don't wanna.
Yeah, I think that prescription drugs have gotten a lot more restrictive today, because that is the highest cost driver of any medical plan, is prescription drugs. I mean, they can be anywhere between 30 and 40% of the total plan cost is prescription drugs. And a lot of that is high-priced drugs, new interventions, injectables. So drugs are the biggest issue, I think, that we have to tackle. And I'm hoping
I have
that
some
our
other
new.
questions for later, but I don't
Yeah.
want to save those.
As you all know, Chatham Area Transit Authority offers a health reimbursement arrangement, HRA. This has been offered for several years. It is specifically designed to reduce a member's deductible. When we put it in, it was, a way to help with that $2,000 deductible that they had. So each member is reimbursed after filing the claim with CAT's administrator, Admin America, for the last $1,000 of their deductible on the middle and high plans, effectively bringing the deductibles down to $1,500 and $1,000 respectively. Now the low plan that we just talked about, the high deductible health plan, which is HSA compatible, you cannot use an HRA with that account. It's either HRA or HSA, but they do have the opportunity to open an HSA savings account and contribute to that. The annual expense for Admin America's administration, they not only do the HRA, but they do the flexible spending accounts, which is the FSA for medical and dependent care reimbursement, including reimbursement of the HRA dollars to employees. So that program with Admin America costs CAT annually approximately $14,000, which is a very good value for what services they're offering. This is the dental plan. We have had the dental plan with Blue Cross Blue Shield as well. Even though they came in with a 0 increase in the dental premium for 2017, we wanted to send it out to the market to see what was there, and we have some very competitive quotes. We surveyed Emeritus, United Healthcare, Humana, MetLife, Unum, and Guardian for dental. MetLife offers a 15% decrease in the premium and a more comprehensive network, plus they'll do a 24-month rate guarantee. So we have a 2-year rate guarantee and a 15% decrease from what the premium is currently. And the current and proposed coverage is the same, $1,500 annual max, $1,500 lifetime ortho for dependent children up to age 19, etc. So it's the same plan, but the network with MetLife is very extensive, and we're getting a 24-month rate guarantee. So our recommendation, of course, is to move it to MetLife. We also have an employee pay. This is a voluntary employee paid vision plan. It was offered by VSP. They came in with a 6% increase to the vision premium for 2017. And again, we sent it out to market. We wanted to see if we can be more competitive on that. So we sent it out to Emeritus, United Healthcare, Humana, MetLife, Unum, and Guardian. Again, MetLife came in with a 16% decrease in the premium with some enhanced benefits. And the enhanced benefit was really on the old plan, you were able to get frames every 12 months. On the new plan, 24 months. Under this plan, it's 12 months, and they also gave us a 24-month rate guarantee. So we're recommending moving the dental and the vision over to MetLife. We also have what the Chatham Area Transit Authority pays for on behalf of employees: life, long-term disability, short-term disability, and voluntary life. We had a 2-year rate guarantee with Cigna that expires on June 30th of this year. Their proposed renewal rate increases was 0 on the basic life, 15% on the LTD, and 10% on the STD. We went back to Cigna to ask them to could reconsider the 15% on the LTD and 10 on the STD. They were not able to improve on their initial renewal offer, so again, we sent it out to market, and we sent it to Unum, Mutual of Omaha, Lincoln, the Standard, and Reliance Standard. Oh, the voluntary life. Yeah, we do have some voluntary life attached to that, and that's included. Mutual of Omaha came in with the best proposal. They gave us a 7% decrease on the basic life, 17% decrease on the LTD, with a few enhancements on the contract language. We got a 10% decrease on the STD, and they also gave us a 24-month rate guarantee. So the estimated savings on the life and the disability products was $30,000 to CAT. The voluntary that people buy up if they desire, Mutual Omaha is taking that over, as is Nobody Will Lose coverage, and they also give opportunities for people to buy it without medical underwriting to a certain level. So no change there. So of course we're recommending that we take $30,000 savings and move to Mutual of Omaha. Wellness initiatives. This is one thing that we discuss almost every quarterly meeting we have with the Wellness and Welfare Committee. We've been working on this for several years. We have a 3-year wellness plan in an effort to promote the culture of health awareness and healthy lifestyles among CAT's employees through education and program promotion, followed by potential mitigation to a results-based reward system. We initiated phase 1 in April, and Blue Cross offered a free biometric screening available to all of CAT plan members. We included an incentive to complete an online health assessment via Blue Cross's site. Anyone who completed both the biometric, and the biometric, for those of you who know, it's a finger stick, biometric screenings and the health assessment were rewarded with a $50 gift card. And I think we had, 37 to 40 people take advantage of that this year. So when you initiate a wellness for the very first time, we advocate taking baby steps to get them started in the right direction. As we move into phase 2 and 3, potentially we want to offer a premium incentive for completing these tasks, as well as seeking support from health and disease management nurse coaches, and for achieving their personal improvement goals. So that's what we're heading for.
With the wellness, I sit on the Curtis Cooper board, and they have programs over there, and I'm wondering if it's worth talking to them for our employees, not only the pharmaceutical, but their clinic in general. I think there could be some incentives and savings there.
Okay.
And I would be happy to set up a meeting with the CEO, Albert Brandy, over there, but
absolutely,
they are running a top level clinic over there, and our inmates at the jail are now on part of that, and the county is saving a lot of money on the pharmacy through Curtis Cooper. So it's just something I think we ought to look at.
Absolutely, we'll look at that. Because I also tell our clients that on pharmacy in particular, Walgreens, Target, they all have pharmacy programs. And they have generics sometimes for $0 cost, or $5 or $2. So I tell employees, if you're taking a generic med, just go on their website and see if you can get it cheaper. Don't pay a $10 copay.
But I'm just wondering
cheaper.
that they are implementing a wellness, a whole comprehensive program there. So in other words, if you see a physician there, you get your meds there, everything could, and an incentive for wellness, be a part of the whole package.
Yeah.
So it's a thought. Because I know it's saving the county some money.
Well, here's my card if you want to set
Okay.
something up.
I will be more than happy to. That'd be great.
I'd be glad to do that.
I would like to see us utilize a clinic that's right here in our own city, and if cost savings could be recognized, that would be great.
And I'd like to discuss that too, and maybe able to offer that to some of the clients too.
And you also have J.C. Lewis right there too.
Right.
I mean, that's the same concept, same deal.
I don't know whether they are doing the pharmaceutical
They are
340B.
doing pharmaceutical, but they are doing some other stuff.
Right, that's the only reason
Yeah.
it clicked, because of what we're doing in the jail right now,
Mhm.
and what it's saving us, through this 340B program.
Well, what our push on the health and wellness is, eventually we're gonna have, this is part of our program, your health and wellness, and if you take advantage of it, you get a decrease in your premium. That's kind of where we're headed. One thing I wanted to address is July 1, and I'm sure you may have read this in the paper, but Seacrest Partners is merging with Sterling Risk Advisors of Atlanta. Once that merger is complete in July, we will be the largest privately held insurance brokerage agency in Georgia. It gives us a lot of clout. And let me just say why we did this. I'm a partner at Seacrest Partners. Most companies our size are getting bought up by the Aons, the Willises, the Gallaghers of the world. We did not want to sell. We don't want to sell. We want to perpetuate the company. We want to take our younger employees, develop them. We want to stay privately held. We want to stay local, and we don't want to sell out. So Sterling Risk Advisors has the same mentality, the same structure that we have. We've been talking to them for, I guess, about a year and a half. So it is a merger. They have there's no dollars changing. They have the same amount of stockholders that we have, and we feel like this is gonna, joining forces with this firm is only gonna strengthen what we already have. When you're looking back at what we just talked about, and you see those big increases from MetLife, for example, those increases are there mainly because of Seacrest Partners, our relationship and our book of business with them. Now we're going to be merging with Sterling. It's only going to get better with other markets. And we feel like this was the best way for us to perpetuate the company, stay local, stay private. And as you see in the paper probably lots of times, Seacrest Partners is very involved in the community. We support so many activities, and we want to continue doing that, and we want to do it on our terms, not a Willis or Gallagher or somebody else's terms. So if anybody asks you about it, it's not a sell, it's a complete merger, and we're very excited about it, and I think we're going to be a force to be reckoned with in the state of Georgia. A few things that Seacrest Partners offers now to all of our clients, including CAT, it plays to our strengths, is we have a Surex membership. That doesn't mean a lot to you guys, but it means a lot in the insurance industry. The Surex is a consortium of like agencies, and there are only 2 in the state of Georgia that have been asked to be partners, and we're one of them. We have preferred broker status with a number of vendors, like I mentioned, MetLife. We also offer to all of our clients access to Think HR, which is a very outstanding HR resource. We vetted lots of companies before we did a partnership with them. We have compliance dashboard that keeps everybody up to date on all the ACA compliance forms, issues, and everything that we guide them through. Did you want to add something?
I was just saying the DOL and the rest of it.
Yeah,
There's
DOL and
compliance
rest of
with
it.
all areas.
And then we have benefit comply. If we have any complicated benefit issues, and benefit technology resources for enrollment systems, etc. But all of these are part and parcel of Seacrest Partners and what we offer to all of our clients. So I know we have a lot of questions, but I just want to say we appreciate the opportunity of serving CAT as your broker, and appreciate your continued confidence in us to do the job. So I'm ready to take questions, and so is Krista.
Okay, then let's open it up to questions. Comments?
When you put this plan together, our product is our employees. Would you say this plan is company heavy or employee heavy?
In what respect? You mean?
Benefits wise.
I would say employee, because you know, when we look at the plan and we look at your employees, by the way, this group of employees that we deal with every year, we come and spend 2 weeks with the employees, enrolling the plan, explaining the benefits, talking to them about the HRA, encouraging their participation. And this group of people are very happy and satisfied, and we always take in consideration, where's it gonna hit them the hardest? It's gonna hit them the hardest in that deductible. It's out-of-pocket expenses, RX, and, you know, particularly RX. So we listen to them during that period of time to find out how can we make it better if we can afford to make it better.
And you also meet with the Health and Welfare Committee,
Yes, we
which
meet with
has
them
employee
quarterly.
representatives on that committee.
Yes,
as well.
we do.
What I liked about your comments, and you made it several times, is that how you negotiated, and that was something that I wanted to not only see what was presented, but negotiate for the best package.
Yeah, we are doing that constantly. Like I said, I've been in this business, hate to give away my age, but over 35 years. I don't accept renewals when they come out because they're usually, you know, they're going to pad them a little bit because they got to make a profit, right? So I'm always going to try to negotiate on behalf of my client. I mean, that's my job as your broker. I represent you, and I'm going to try to get the best pricing, the best benefits, listen to your employees, and find out, you know, if they're happy or not. Nobody's happy with the premiums. I mean, in the whole world, nobody's happy with the premiums. And in the ACA world, we have to address the fact that we have to have a program or a plan in there where your lowest paid employee, which is a $10 an hour employee, cannot pay more than 9.6% of their W-2 earnings. That puts you in a category of we can't charge that person more than $125 a month for health care. And when you're trying to work that back into a 70-30 split with the, you know, the CAT and the employees, it's difficult to get there. What got us there on this plan was the high deductible health plan that we're offering. I don't see a lot of people signing up for that. We said maybe 5 to 7% may sign up for that. But it's there and it keeps you compliant, and that's what we are concerned about. We don't want you to be penalized because you're charging too much for these employees. So we had to back into that number, and we did it with the low plan. But they have a choice. They don't have to take that plan. They can take the middle of the road plan. They can take the high plan.
I have a question when you get.
I'm just gonna make a comment, and then we'll give it back to Jay for his question. When you look at what our employees were paying this year, based on one of the other things you have, they're paying about $530 a month for the existing plan. And when you go across to the new plan that you're offering, we're actually, the employee's going to be paying less.
Yes.
Correct? For the high deductible plan, the middle deductible plan, and he's only going to be paying $30 more to get the high plan.
That's correct.
So I think from an employee standpoint, this is a good renewal.
Absolutely. And the reason, if you'll see on that high plan, those two highlighted areas, that's what we negotiated with Blue Cross to keep that low premium, but give us a concession right here for the out-of-pocket, especially the family, because it was $9,000. So we got them to back off on that and still keep that premium. So that's why it looks like, you know, the plans are identical, but this plan is low.
Yeah, but for the employee, it's a good plan. I've got other questions, Jay, but you asked the question first, so.
I just want to make sure with the reduction of the premium changing over to different insurance agencies, are we losing anything? Are the employees losing anything? Because it doesn't highlight what they may be losing. Because I know when you change from one insurance company to another,
Yes.
and if you're changing the price and the premium, you're going to lose something. What factors are the employees losing? I'm guessing.
So I think you're referring to the dental and vision and the life.
Correct.
Yeah,
Yes, ma'am.
to the change.
You want to address that?
Sure, in my eyes, there's always, you know, when you're dealing with networks, you're never gonna be able to get 100%, that's why each carrier has different networks. From a benefit standpoint, they're gaining in the vision, they're gaining frames every year instead of 2 years.
And I love that. I love that. I
So
did
they
say I
didn't
didn't love
lose-
it.
I
Yeah,
like
no,
that too.
they didn't lose anything, but to address, I'm sorry, you're asking about losing, they didn't lose anything there. The VSP network is different, but MetLife uses VSP, okay?
Okay.
So, I'm sorry, I meant to say the dental network is different, but MetLife uses VSP's network. So VSP, IMED are direct vision care, vision providers, I should say, and then several other carriers will access, and then some carriers will actually build their own. MetLife uses VSP, so there's nothing they're gonna lose as far as the vision. It's the same providers, they're getting better benefits.
They
and
get
they're
better
getting
on
less.
vision. Okay.
Now, on the dental, it will be different, but MetLife, you know, Blue Cross has a great dental plan. We've been very happy. The employees have been very happy with their dental coverage and the providers, but MetLife, that's more of what they do. You know, MetLife only does dental, vision, and life and disability.
Yeah, they have no medical.
I've
They
had
don't do
that like
medical.
15 years, I understand.
Okay,
Yeah.
so they have a broader network, a more comprehensive network. They also have a stronger negotiated rate. So when you're saying the plan's gonna pay 80% of something with Blue Cross and 80% of something with Met, the base of that starts lower. So it's an
Okay.
advantage from a couple of points. So again, I'm bringing up the advantages, but they're not losing anything.
Right.
There may be some providers, and I haven't looked at every single one, because that's very hard to do. They
'Cause I
may be
don't- I
seeing
don't-
somebody who's in Blue Cross and not in MetLife.
That's
but
what I was getting ready
it's
to
That would be
very
hard,
possible,
Because
but it
I've
would be
been going
very-
to this dentist for 10 years, and now I can't go because we changed providers.
Okay, so a couple of ways to address that. That may happen. With dental plans, the out-of-network coverage on dental plans is what's, we call a passive PPO. So unlike the medical, you know, if you go out of network, you're hurt, you pay a lot more. Dental plans have, we set it up, it's called a 90th percentile. So MetLife is gonna pay any dentist that's not in the network what 9 out of 10 dentists charge in any area. So from that standpoint, even if you're going out of network, you're still getting a benefit. There's a chance that you rebalance billed, but when you're paying what 9 out of 10 dentists charge, there's just a very small chance. So even if you run into that situation where there's a different, you know, the provider was in Blue Cross and is not in Met, you can still go see that provider and you're probably still gonna get the same benefit.
And
And
I'm
not
guessing
only that, you
services
can have that
change, too.
provider join the MetLife.
Services
Like
too.
if I'm getting crown removal, might be different from one provider. Is it? I'm asking.
That's part, yeah, that's a good question. That's part of what we do through our process, is we look at all those things to make sure that it's a match. And
Okay.
we have done that. I could, you know, there's a lot of them, and if you picked out a specific one, I'll go to the contracts and show you, but they're
Okay.
not losing anything.
I just want because that's going to be the main drawback.
Yeah, and the disability is the same way. We actually got an improvement in the language on your disability.
Okay.
So let me know if you need the details.
And then the other question I had, and I'll default, and I ask my other questions after everybody else asks their question. It says reasonable copay, and can we elaborate on what reasonable copay means? Because I just don't want to say reasonable copay. What reasonable copay to me might be different from what it might be to another commissioner, another person. So in the language under it says fact finders, it says market for its employees with reasonable copay.
Yeah.
Can we elaborate on that a little bit?
Yeah, if you look at the copays on the, let's just go to the high plans, it's more like what they had before. There's a $25 copay for a primary care physician, and then $50 for specialty. That's pretty standard in the market. So that is what we would consider a reasonable copay. The urgent care is $60. Sometimes that's a little bit higher on other plans.
Yes, ma'am.
And the emergency room copay of $150, that's pretty standard as well. Although I see more and more people going to a $200. So yes, those are reasonable copays.
I got you. And in my last question, I'll probably defer.
You have the floor.
Commissioner Holmes stated that, and it may not be the question, you may just be, I don't know who to address it to. He stated in reference to a group of employees was discussed with this. What was the makeup of that group of employees? Maybe this is I see.
You wanna address that?
What was the makeup of these employees? Was it a mix of operators and a mix of executives, bargaining, non-bargaining? What was the mixture of it?
Our Health and Welfare Committee
Yes, ma'am.
is comprised of 6 members, 3 of them from the administrative side. That includes myself, our HR coordinator, Tandra Scott, and Terry Harrison. Now it's Mike, yeah. Now that we have Mike Brown on board,
Hey,
he's
Mike.
taken the place of Terry Harrison. And on the employee side, we have our union representation, which includes Calvin Kennedy, president, Fred Jones as the vice president, he's present today, and Kenny Laurier, who is the shop steward.
Okay.
Those are the folks we meet with on the quarter, every quarter.
Then my other questions will come to the board. I'll probably just talk to Mike and ask Mike some questions on that. And that's all I need to know.
Helen?
Thank you.
Just real quickly, I touched on this, but is there a way that we can have more incentives for compliance with primary doctors and wellness? I'm just seeing a huge savings nationwide with companies that offer incentives for wellness, and physical fitness and every
Yeah, that's what
every
we're trying to
component
do,
of that.
like in,
Because it is already proven that if people can get on a fitness and wellness program and sustain a reasonable weight, they can get off a ton of their existing medications. And I would really like to see us put incentives out there for our employees to be healthier, to feel better, to miss fewer days of work, all these things that,
that was absolutely our goal with the phase 2 and 3 of our wellness program.
it is so important, especially this day and time with the rising cost of healthcare and medications and hospitals and et cetera all the way across the board. But I've got a whole bunch of research that I've done on that is very clear. So anything we can do, for our employees to make them feel better, work better.
It's all about changing behavior, and that's
Yes.
probably the hardest thing to do with employees is changing how they think, how they behave. And with like phase 2 and 3 of this program, we will be introducing the spouses in the program as well.
Right.
Wonderful.
Because you've got spouses on the plan that are incurring claims as well.
Wonderful.
So we need to incorporate the spouses. It's just, we just need to kind of increment it because,
And the
you get a little
and the
pushback.
county needs to do the same thing. I'm not picking cat out, but I'm just and I used to be a weight loss consultant, so I know I've seen people get off of their blood pressure meds, off of their cholesterol. I mean, it's just remarkable when you get your body to where it needs to be, the savings, and how much better people say they feel.
Well, I mean, 80% of all of the claims that are incurred are due to lifestyle.
I mean,
Diabetes and all of that stuff is
if
lifestyle.
there's a way for us to,
Some kind of credit system.
right, and also some type of a metric system of measurement of this. If we could take this organization and say we're going to be the healthiest organization in Chatham County, and these are the steps we're taking to make our employees feel better, work better, have a happier lifestyle, then I think it would be really good.
I concur.
Absolutely.
Yeah, but just like you said, there are many employees that just don't want to do those things. For example, the main thing was on some of the companies is stop smoking.
Right.
As you know, the number one thing, stop smoking. And people didn't want to stop the smoking, and that it's just simple as that. And that was part of the wellness program and gave them some incentive. If they did stop the smoking, that would be okay. But if they didn't stop smoking, then they had to pay a penalty.
Yeah, and you can put, and we have penalties, included, but again, it goes back to behavioral changes, because if that person does not want to quit smoking, they don't mind paying the penalty.
Yeah.
I mean, they will pay it because they're
I'll
like.
make them pay it because it's not fair to people that don't smoke.
And you can do on those kind of things. You can on the wellness incentives and stuff. You can do about a 30% up to.
Well, I know
30%.
for the county, any employees that smoke now, exactly what Mr. Lakakis was saying, has to pay more.
Oh yes, I mean with insurance premiums and all that stuff like that, with smoking is one thing, non-smoking is another. I mean, I would not be a smoker because it's $17 cheaper for me to pay it per month than it is to be a smoker. So I mean, I agree with you on that.
Not to mention the cost of cigarettes.
Yeah. That keeps going up.
It amazes me when I see the statistics about how much more younger folks are smoking now, because we know now, and they do too. But it's amazing.
It's not as many filters out there as it was back then.
So maybe we can, Calvin, maybe we can go to the back of the room. So we've been talking at this end of the table. So
I'd like to see all this.
what's your feeling as a member of the union?
We were just making some comments as we were perhaps the cutoff was more small. I think maybe it'd be an incentive if one would stop at that, and increase the
But as far as the general program that's been presented, as far as the general program that's been presented, the switching to midlife,
no objection. We reviewed it yesterday, and we were pretty much in sync along and recommending. We think it was a pretty good, pretty good area now. The International Amalgamated Transit Union, which is one of the largest in the country, they also make recommendations with insurance. And the ones that I have seen, not very much from the ones that Seacrest is offering.
okay, 'cause before we vote, I just want to make sure that the employee base is comfortable and is aware of this.
I appreciate it.
So do we have any other questions? The only question I've got, and it's got nothing to do with the proposal itself, just sort of the mechanics of it. So within our employees, how many are single, married, with children, and family?
We have, how many have enrolled as an employee only or employee
Yeah.
spouse?
Statistical breakdown.
And I can remember it off the top of my head if I can't find where I put it. You have about 93 employee onlys, 33 employee spouse, and it was evenly split about 23 with children and then 23 enrolled in family. You have about 178 was your average. Now that changes every month, obviously.
We only have 23 with families.
Yeah, it was a low number.
That's real.
That's a stat.
What's our percentage insured?
That was enrolled.
Okay,
Okay.
what's our
About
percentage enrolled?
178.
178.
It's
Out of 237, right?
237 employees.
178 out of 237.
So 180 out of 240.
Okay.
Yeah, that's.
So the big percentage
I thought it
is
was
taking married.
percentage enrolled.
Right.
I'm not even gonna try to do
Or
it.
they're taking up through their
Yeah.
spouse and not through us.
Yeah, but I would expect that this plan is very rich.
It is a rich
I would
plan.
expect that we may have more spouses taking
So you
insurance
just-
through us than the other way around.
How many part-time versus full-time?
We don't cover part-timers.
That's why I'm asking. How many of that 237 is part-time?
Oh, perhaps 35 of them are part-timers.
So you gotta skew that number out
182,
too.
yeah, 180 of 2, so.
It was just a curious
I appreciate
question
it.
about the mix of our. And then how did we make the decision that we were going to have 723 and 70% high, medium?
How many people in, or the 70/30
The
split?
percentage, but how'd you come up with 70?
We just took that based on what we've seen in other plans that we put together, because obviously we have lots of different companies. And we just look at the percentage of, when you offer 3 plans, where do most people fall? And we honestly think with this plan, the people that are in it right now, I think we're gonna have a higher number in that high plan.
I think you're gonna have an
Because-
upgrade
Yeah,
too.
because it's comparable to what they had, a little bit less than what they're paying. They're gonna be excited about it.
Yeah, I agree.
I think they'll be very, very pleased, because there are a lot of groups that we go into and we can't offer this. There's always a rate increase. How do we, negate that by, doing something to the plan? And we've had very, very good experience, with Blue Cross Blue Shield. They're very loyal to this group. I mean, they're loyal to the fact that you guys have been with them forever, and they do give us some concessions that they won't give us on another group.
And they send a team down at least once a week
Yeah.
to meet with our committees, so.
I mean, I think for the small difference in price, where we are today to the high deductible plan, considering what you get, I think it's a very good plan for employees, and I think that you're gonna see a big upgrade to that high deductible.
I agree.
Low deductible plan.
And what's really good too, joining up with Sterling Risk, that's gonna be a lot more advantages and, things that can be done with joining up with them, like, Seacrest.
It is. It's gonna be a very big plus for Seacrest, not only on the benefit side, but, on the property and casualty side as well.
I think it's important too. I mean, I know there was a reason why a few years ago one plan was offered, but we we felt as an agency when we met with Seacrest that having one choice is really having no choice. And to have them come up with options for people, at least so it's in their power to decide. And they came back with this 3-tier thing at our request, and we were extremely pleased with how it transformed and actually gave employee options. Because at the end of the day, you want to at least be able to have some control. And so I appreciate them going back on short notice and reconstructing this for us.
And the other thing you're talking about, Seacrest, all you look at is their history and the different companies and the things that they offer, that it'll show you multiple ones are very, very satisfied with Seacrest for the things that they've been doing.
Thank you.
Okay, so I think that while I would have liked to have had more notice and been able to think about this a little more, I'm not uncomfortable myself, and I'd like to propose we take this for a vote. Do I have a motion to approve?
Okay, but I would like to just, I don't want to make this part of the motion, but I really would like for us to move more towards working on the wellness incentives for our employees. I really would like to.
You made
You
the
want to say
motion.
that now, or?
Jay?
I'm talking about going
She's making a
forward.
great point. I mean,
I'm talking about going forward.
We noticed we
made the
didn't
motion,
explain
I'll
very
second.
much on option 2s and 3s as far as moving in that direction.
Yes, we are.
Would you like them to come back at a later date and explore option 2s and 3s?
I agree with her.
I
Okay.
really would,
To see the
because I
detail?
think it's important to show this organization that we care about the health and welfare of our employees, as well as the bottom line on the budget. I really do.
And to piggyback off what she's saying, based on the numbers in my head, we're 9 out of 10 insured, and I can probably say it's 10% that's not insured. But not saying they're not insured. They have a spouse who's insured, and they're under their insurance. But I would like to know how many people full-time are not insured, whether they're insured under their spouse or they're under the 90%. So taking that 10% they're not insured, to find out how much of that is not insured, that we can actually try to get them on board on some of these plans.
And in addition to that, I will follow up with you with
Okay.
Curtis County.
And can I get a card too?
Oh, absolutely.
Since we're asking for things, I'd like to see how we compare to the county and the city at some point.
That'd be a good point too. Appreciate it.
Okay, so we have a motion on the floor. We need a second?
I second it.
We have a second?
Better late than never.
Well,
Great time.
I haven't got notice now.
Okay, so we have a motion and a second. All in favor say aye.
Aye.
Opposed? Motion carries.
I would like to say.
Hey, Ty, appreciate your service.
I would like to say one thing to Seacrest and for the board's reference. What would you suggest to do? I think it might be prudent for us to possibly every May to move our board meeting towards the end of the month, or a third week of the month, so that maybe we can time it to where it can.
Yeah, I'd rather do it in
be
May.
given
I'd
the
rather do it
notice.
in May.
Mr. Chairman, I'll make a motion to that effect.
I second that.
And just as an FYI, the property piece of our insurance has not been finalized, and staff will not get that information or meet with the Seacrest reps until mid-June. So that will come at
So
the
that will
June
be the time
meeting
for next
for a
year.
7/1 renewal. When we have the information from Seacrest, we will get it to you in the form we have it as soon as possible, so you can.
Okay, so we have a motion on the floor to move the May meeting to later in the month. All those,
I second it.
When we
Say aye.
what are we talking about date-wise, like,
We don't know yet.
The
It won't-
third
it'll
or
be a
fourth
ne-
week,
it'll be-
whatever's
it'll be next
feasible. I
year.
know we have the holiday weekend, but maybe move it at least 1 week later than it is now. So like the 23rd instead of the 16th kind of scenario. And obviously moving it to the 30th at the end, which coincides with Memorial Day. Probably not feasible to do that on a Tuesday after holiday weekend, but the third week we may have been able to time it and work towards actually giving the board an option to even table something until an early June special meeting, so you have information early. But I mean, obviously the way we did it now, the board feels they didn't have enough time. So I would just say, as an option, we look at moving the date so we can see if we can create a better scenario.
I think next year, if we come in and the rates for some reason or other, are taking huge increases. We're not gonna be sitting here
It's not
then.
going
Two of the options have
Don't
24
even
lock
say
in
it.
one
It's so
city.
expensive.
But we're not gonna be sitting
We
here.
should have no problem
I mean, I said two of the options already have 24-month lock-ins, so
Yes.
it won't even be a problem with two of them.
Okay, so then we have a vote. All those in favor say aye.
Aye.
Opposed? Motion carries. Now we're adjourned. Thanks, Ty.
Quite well.
Thank
you for calling my advice.
Excellent.
When dates are available?